Hi, my name is Joya Jefferson Nuri, and I am your conductor for this profound conversation hosted by the Muslim Life Planning Institute. If you've been following this broadcast, you know that over the past year, we've been talking about organ donation, organ asking families and how that works. But the one thing we haven't discussed yet until today is the grieving process. The world knows more about grieving now than probably it did 2 years ago as we grieve in mass numbers around COVID. But families that are facing the choice of either donating a family member's organ or your choice to donate your own organs upon your death cause a level of despair. Whether you have chosen to donate the organ or not, it has to have an impact on you. So in this conversation, we're going to talk about grief in this process and grief in general and what it is and how we manage it and how people have managed it on a person-to-person basis. Please allow me to introduce our illustrious panel for this profound conversation. We have Dr. Clive Callender. Dr. Clive Callender is a noted expert in the organ donation world, and today he is the professor of surgery at Howard University. Dr. Callender, welcome back. And like
Thank you. It's a pleasure to join you.
Our next guest is Ingrid Palacio, and she is the multicultural community program manager at the New England Donor Services. Ingrid, thank you for joining us today. Okay.
It's my honor to be here with this amazing panel. Thank you.
Thank you for your time. Another frequent guest, and I'm always happy to see him, is Joey Bordeaux. You think I would know your name by now, right? Joey Bordeaux.
All the time.
Yes. He's the Chief Clinical Officer for Louisiana Organ Procurement Agency, LOPA. Again, welcome back.
Thank you for having me again.
New to our panel is Nyla Schwab, and Nyla is the Family Services Coordinator for LOPA. Thank you for joining us. Thank you.
Thrilled to be here.
Yes. And last, but certainly not least, is Cheryl McGee Hills. Cheryl is a community educator with Louisiana Organ Procurement Agency, LOPA, but she also has personal stories to tell about this process, about the grief about it. So Cheryl, if you don't mind, I'd like to kick the program off with you. You have a very touching story to tell us about your husband, Roderick.
Good afternoon, everyone, and thank you for allowing me to be here. I started out 1994. Roderick was suffering from high blood pressure. He found out 6 months prior to him sustaining the seizure that he had hypertension. One night I heard just some noise going down the hallway and I discovered him on the floor. We got to the hospital and he was diagnosed with renal failure. It was a surprise to me because I didn't understand it. I knew about high blood pressure, hypertension because in my family, I know my relatives still have that issue. And of course, his mother and his grandmother who raised him. So we were told that Roderick was placed on dialysis, and that was a blow. And so dialysis started within 24 hours, and it continued 3 or 4 times a week for a period of 5 years. He was placed on the waiting list about 6-9 months after starting dialysis. And it was I would say a crazy time for the family because not only I had to explain to the children, but both sides of the family and understanding what dialysis was all about. And then after the first year, learning that someone can donate him a kidney. So that was that's a whole new chapter in my book I'll be writing before I leave this earth on not only explaining to family members about dialysis, but then asking who would like to be a donor. Of course, he Roger ruled me out and the kids, and it was just a shock to everyone. In the 5th year, I received a call from one of my sisters. I'm number one of 9 kids. So she said my brother, Lionel Brazil Jr., we called him Teddy, had a terrible headache and was rushed to the emergency room. And by the time I got there, he was in a coma, and the doctor said he had suffered an aneurysm, that they were going into surgery to see if they can reduce the swelling. And that was late Friday evening. I'd gone to church Sunday morning. When I got off the elevator, leaving church, got to the elevator at the hospital, and I saw a lot of family members there. I knew something had happened, and he was pronounced brain dead. Being the number one kid, because I called my dad, he refused to come to the hospital. He was in shock. Because this is a 36-year-old man, didn't drink, didn't smoke, didn't have any health issues that we knew of. And I was told, Cheryl, you make that decision. I couldn't make that decision without, sharing with my family, what is going on, because I was the one approached about organ donation and do we have consent? And her name was Rebecca. I never forget her name, a local employee. And she said Lionel was an organ donor. He had it on his driver's license, but of course he didn't share that with anyone. And I remember my uncle saying, Cheryl, you don't need to rush. Another sister said, let's pray. It was just for 3.5 hours. It was just so many emotions. And one of my brothers, Chet, he said, you know what? He wanted to be an organ donor. He wanted to help somebody. Of course, he wanted to help Roderick. I just won't forget the way he said that. And everybody agreed, let's donate his organs. And my aunt said, well, let's see if Roderick could get one of those organs. And so the doctor said, direct donation, of course, let's run some tests. And of course, Monday morning, I got the call that it was a match. Mm-hmm. So my husband received one of his kidneys, and a man in Slidell, Louisiana, someone out of Mississippi, Georgia, and Florida received the other organs. And that began the journey, the first step of learning more and more about organ donations, because when it came to checking off the box, what organs can be donated, I was the first one to say, oh no, don't touch his eyes. Mm-hmm. I remember that. I clear on that, don't touch his eyes.
Why were you so clear about that, Cheryl?
I didn't know more. I didn't know much about eye donation. I knew about organs and the number of organs can be donated, but at that time, I just didn't want his eyes, his face to be disfigured, taking out his eyeballs. Oh, yeah. That was my knowledge of tissue donation at the time. Mm-hmm. I knew about organ donation, but my concept, my understanding of tissue donation and the disfigurement and the casket, I couldn't say yes to that. And I realized I couldn't even explain it to my siblings and an uncle and a sister who just couldn't believe he wasn't dead, and get into all that. The emotional, it was just so many emotions going on. I just thought, let's organ donation. So I said, oh, no, don't touch his eyes.
Cheryl, for just a second here, I know there were a lot of emotions going on as you were describing, and it sounds like a very, very awful process. This is your husband, and it's your brother-in-law. And tell me what you were feeling. What was outside of them? What were you feeling?
It was crazy because I've always grown up being the number one kid of 9 children. My mother had already passed away, and my dad depended on me for a lot. And so I realized I had to keep my cool. But I was angry. Mm-hmm. I was angry. I was definitely scared because my brother's gone, but yet now I have to go through the surgery, the transplant.
Right.
And I didn't know what to expect. And I don't know, it was a lot of things I held in for a long time.
Mm-hmm.
And when I was able to share this, and I hope I'm not getting ahead of myself. I probably will, but I did not seek comfort until I became a volunteer with LOPA. It was 6 months after his transplant that I received a call from one of the community educators to become a volunteer with LOPA, Roderick and I. And he was excited about it because if you ever met a recipient, they always want to give back. They want to share the story. They want to help. And one thing Roderick did was he went back to dialysis center to see his friends to tell them about his transplant. And he realized how our community, especially the African American community, didn't understand organ donation, was afraid of it. And a couple of months, I remember, because he would go back every week because there was a routine at the dialysis center. I guess it was the bro talk, the girls talk, everybody knew each other. And a couple of months he went back and his friend that sat next to him passed away. And he said that it was important that we do this volunteer work. Okay. And it was amazing because LOPA, there's a cab service called Metro Cab. Every Saturday or Friday evening, Saturday morning, we would get supplies from LOPA and we would go to church. We would go to churches every Saturday for health fairs. Every now and then we did a car dealership, which was exciting, but that's how my journey began with organ donation and also my education.
Okay.
Yeah, I began to understand tissue donation at that point.
Okay. I'm going to ask Nyla to jump in here. You are a family service coordinator. I'm sure what Cheryl described is something you see all the time. Can you talk to us about that?
Yes. So it's hard for families. When we initially talk to a family in the hospital, like when Cheryl said someone came to talk to her, it's not, I think a lot of times that there is shock. I mean, did you feel shocked, Cheryl?
Oh, yeah.
And
I was shocked.
Very hard to think when you're in shock. So we in the front end, we support families the best we can. But then on the back end, where Cheryl comes in and gets involved with LOPA, that's so different for every family because some families have a lot of support around them. Cheryl mentioned she didn't seek comfort, and it depends on where that comfort comes from. So in the South, you have a lot of Southern families. We have our churches, we have large communities, we have large families. But some people have none of that. So it just depends. It's all individual. And we never want to leave a family feeling alone. So when we reach out to a family, how they respond at the hospital or at the initial time of death is going to be so different than when we speak to them, I don't know, anywhere from 10 to 20 days later. And then that's kind of where our department steps in. And now we support families. It's a little bit different probably when Cheryl was being supported, but we've grown as we learn, like today, conversations like this, how do we better support our families? And we continue to grow as we get feedback from families, as we learn from other people what our community needs. Our community needs change constantly. So we support a family anywhere from, we support a family for 15 months. And at that point, we hope that there is healing, or that they would like to get involved. If they would like us to extend that, we will do so. But some families right away can say, I have my support, I'm comfortable. We wanted to help people and we don't need any other support. So it just depends on, we meet that person where they are.
Well, Nyla, what does support actually mean? This is a program about grief. What does support actually mean?
Well, that is a very good question because that can mean so many things. We can talk to a family. When you say grief, there's so many types of grief. A lot of times when you talk about grief, people want to say, oh, it's a loss of a loved one. But when you lose a loved one, you also lose those dreams that you had for that loved one, the dreams and the future that you had planned for yourself and that loved one, whether it's a widow or a parent. So we look at grief, loss of job. That might be the only primary income coming in for a family.
That part I understand, but I don't understand where your job is. And anybody else can chime in.
Well, and
What do you do if somebody is grieving? I mean, grief comes in physical forms. People are crying. People are in fear. People could be angry. People, like Cheryl said, confused. So for somebody who's outside of the family, physically, what do you do? Or physically, what do you say to people who are like distraught?
I think that's going to be first of all, are you at the bedside with the family? And is this the acute grief where they just have learned of the death? And
let's say acute grief, they just learned of the death.
So that is going to be, are they getting their questions answered by the physician? Are they having their, sometimes hospitals, especially now, aren't allowing family to come in. Yeah. So you may have one individual. So we're gonna work with that hospital to have family at the bedside with that person making the decisions. Can the family really keep all their thoughts together to ask the questions when the doctor comes in to answer questions? So it may be having a notebook at their side and helping them list out the questions they need to ask. Mm-hmm. Also, your throat closes up. I mean, if you're crying a lot, your throat gets tight. So we want to make sure, do you have a peppermint? Do you have water for that family so that they can talk and it kind of recenters them, grounds them, brings them back to the decisions they need to make? So that type of support. Okay. Isn't that acute grief?
I tell you, I'm sorry. No, tell you what, something just came with Nala. You know, it's so many different levels of grief. You said acute grief. With Roderick, and then years later when he passed and we donated his corneas, I remember the grief from my brother and the grief during Roderick. It was, we had different levels. There were family members who still couldn't understand with my brother's Teddy's death and the connection with Roderick and his death. It just brought up my brother's death along with Roderick's death. So it opened up a whole new grieving process.
Oh, wow. Okay.
It opened up a whole new grieving process. And the only thing that happened when my brother passed, I'm going back and forth because everything is coming back to my remembrance. Mm-hmm. At his funeral, the pastor came to me and said, "Don't worry, Roderick is doing fine." And he has to make a statement. He said, "Roderick is doing fine. He peed, his kidney is working." And this is at the church. And I remember everyone was excited about it, but yet I looked around, some people wasn't touched by it because they were just so full of grief from the death. It was a joyous and a joyous occasion, yet a sad occasion. Right. And I would, for me, I know it's different, but just think about families who don't know their recipient.
Well, you said something earlier. I want to bring Dr. Callender into, Cheryl. And okay. Dr. Callender has been working tirelessly for 40 years or more, trying to educate the African-American community on organ donation. And he has had successes and I'm sure some failures. In this grief process, Dr. Callender, and in all of the back and forth, we want to pray about it, we want to talk about it. Some family members don't understand at all. And yet a family member like Cheryl, who has to make the ultimate decision, is using them as counsel. How much impact does the lack of information add to the grief process when put into the choice of organ donation?
Well, one of the things that is unique in this case is that Cheryl had it on so many different fronts at the same time. Mm-hmm. And to be honest with you, we are ill prepared to deal with somebody who's dealing with not only the death of a brother, but also the fact that his death will then result in second chance of life of her husband. So dealing with both of those issues at the same time is not something that we frequently have to deal with. And so I can see why Cheryl was really all alone, because we are ill prepared to understand the depth of grief and angst that she is going through. Education is one thing. The act of grieving and understanding what somebody who is grieving has to go through is another. And I think that as I look at what she had to do in terms of making the decision about her brother and also making the decision about having her husband receive the organ, that combination, that complex, is something that is really dealt with. And I think that we are very ill prepared in general to help somebody through the complexities of this issue. And I think it's amazing that she could actually proceed with the transplant of her husband from her brother, because she's agonizing. I can't say no to my husband receiving my brother's organs, but then how do I close this issue about my brother dying? And then so this complexity generally would often result in somebody not actually donating. But to her credit, she recognized the opportunity that existed in this midst of turmoil. And she made a decision that is entirely commendable. But that did not help her. It's interesting to hear her story. That did not help her. As time went on, she still felt that dichotomy of being excited about her husband getting a kidney, but then dealing with the loss of her brother. So I think that this is a unique circumstance that, in spite of the grief, she was able to allow for the donation of the organs. And even though she didn't deal with the corneal, she dealt with the organs magnificently. And the fact that even months later, she still was grieving is not a surprise, because grieving is forever.
Right. And I know that grieving, thank you, Dr. Callender, for that. And thank you, Cheryl, for being so open about your story. It is informing this entire conversation. And I want to now turn to Ingrid. Ingrid, you are you work as the multicultural program manager at New England Donor Services. And we all know, or we all have a notion that different cultures grieve differently. Obviously, we all grieve differently as individuals. It wasn't race that had Cheryl grieve the way she did, but each culture does have a unique way of grieving and how they express that grief, and what a church service or a synagogue service or a mosque service would look like, and how the family processes. Can you share some of the stories you know?
Absolutely. And also, I used to be a family services coordinator or family support coordinator also for 8 years for 2 OPOs. So I'm very familiar with that process when working with donor families. So first of all, I wanted to say, Cheryl, I'm very sorry about your losses. And thank you for inspiring us, because these stories like yours is what, as you know, because now you work with LOPA, is what really keep us going. And I can relate in so many levels. And when you were talking about the eye donation and not being, that you call yourself now educated enough, that's a common denominator when it comes, it's through cultures, also for the Latino community. I'm Latina, and it's something that always stands up because of the same fear of disfiguration. the same fear of dismemberment. We're not thinking on on cornea recovery, being corneas, just this the thickness of a contact lens, just the top of the eyes. We don't think that the person or loved one is gonna have their eyes closed, regardless if they're an organ donor or not, or a cornea donor. So that is something across, I feel, cultures, especially in African American and Latino cultures that I work with, I don't know, probably thousands of families in all these years. And so it is important. We kind of try to, as also Nila say, meet the family where the family is at, respecting that the level of grief and also the cultural piece. In the Latino community, I think it's well known, and we have discussed this in the past, how we are a very personable collective culture. And so whenever one of us is even sick or the hospital, is not only the family members that are very large sometimes, and it's also the people from our churches or from the community, our neighbors. I joke and say even the dog is there at the hospital, and that can also cause, it can become a barrier sometimes when working with the hospitals, because if we don't have professionals that are, like Dr. Callender put it perfectly, beautifully, not all of us in this, even in the healthcare system and the hospital system, are equipped or educated to work with different types of grieving, different types of culture. And so sometimes we get to the hospital, like the family services coordinator or the organ procurement organization staff, and there is, we are salute with saying the initial thing that the nurses will say, or someone will say, it's like, oh, there's like 50 people there, good luck. It's like, we have to call security, because I'm like, what happened? There's just too many people. And so that already is hindering the relationship or the engagement that we can have from that family, because they're grieving. They're not going to separate also why the security is being called on them, and then here I come, or here Nila comes, or someone comes to come and talk about their organs and them saving lives.
Right.
And so
they already feel like off-put because of the general culture's reaction to the way they deal with sick people.
But they're gathering. They're supporting each other.
Right,
you ask about that support, and that is another thing. So think about not only the Latino communities or different cultures that are non-English speaking, and they cannot communicate, or they cannot be understood from the hospital staff.
Right.
Sometimes, and we'll hope that, an interpreter will be there from the get-go, but that doesn't necessarily happen. That only happens when there's meetings with the doctors. And so you have that ticking bomb, if you will, with families that are not being supported the best way. And I am not in any means saying the hospital doesn't provide that, because they do have amazing resources. But when you were asking Nila about the support, how does that look? What we do, we get there, and in a personal, professional level, like she said perfectly, we have to meet the family where they are. Let's address their basic needs also. Have they eaten? Are they cold? Have they slept? We are there first as humans to connect with that family and provide that support. Are they being understood? Is there an interpreter on site? Are they religious? Can we call a chaplain? Yeah. Are they dealing with a lot of children that they need to take care of, and then being in the meetings with the doctors? Can we call a child specialist? Is there a social worker that is already involved in this case? So this is a collaboration, Joya. This happens, we all maybe individually not be the best, resource and educated, but when we are there, we're these dual advocates, not only for those donor families that are grieving, but for the people in the waiting list that are also about to grieve or are like even Cheryl said with her husband, people that are waiting. There's over 106,000 people, adults, children waiting for an organ. So that support takes all that shape. We are there to be advocates. We are there to be liaisons. We are there to be those people that will honor those families' wishes.
Right.
Sometimes they are already registered donors, sometimes they're not. And that's when we are able to, we have that duty to educate and to inform so they're able to save more lives.
I want to piggyback on that. Joey, I'm going to get to you, but I want to piggyback on what you just said, Ingrid, and go to Dr. Callender. She said sometimes people are registered and sometimes people aren't. Do you find it easier for families to make this decision about donating the organ when the person has already made the effort to be a registered organ donor? Is the grief relieved a little bit when, like, I made the decision before I got into an accident or had an organ fail?
Yeah, you know, it's interesting because what you asked a good question, because now the law requires, whether the family likes it or not, that if you decided you wanted to be a donor, you will be a donor. Mm-hmm. And if the family doesn't like it, it is unfortunate, but the donation will proceed. Mm-hmm. And if the donation does not proceed, that presents a legal case, because it's against the law not to proceed if the person has already given consent. And most often, in my experience, it does make it a little easier for the family when somebody has already said, I want to be used as a donor. And so it does help, but in some instances, it causes a lot of turmoil. But in the majority of cases, it's beneficial.
You know, in my personal family, I love them to death, but there's a section of the family that would totally organ donation. Let's do it. You can be an organ donor. We support whatever you decide because we support that. And we've already told the Department of Motor Vehicle that we want to be organ donors. There's another section of my family that is vehement that if you donate an organ, you're going to end up in heaven without your kidney. And like, God doesn't want people back who don't have kidneys. I mean, they really have this belief system. So I now want to take this to Joey. Joey, how do you, in your job at LOPA, reconcile that? Now, Dr. Callender says that the law says this organ donation is going forward. If I've already said I'm an organ donor and I want to tell everybody I am an organ donor, whatever I have that still works, let somebody else have. But how would I reconcile that with my family members who would be in a pitched fight with the other half of the family? I pitched fight with the other half of the family that says no. How do you handle that?
So, Joy, that's a great question. It's a difficult position to be in, and I know Dr. Callender's seen this all too often. I can tell you first of all. So when the family knows, and I'll kind of piggyback off of what Dr. Callender said, I won't say that their grief is any lesson, but I've been in the situations that Ingrid's been in. I've been in the situation that Nyla's been in. I was a family support coordinator originally at the start of my LOPA career. And when they know that their loved one wanted to be an organ donor, it is a completely different place that they get to in a lot sooner aspect. So we see that, and it's to the tune of, we've had 56 first person authorizations, 56 times that a person has said they wanted to be on the registry. We've had a total of one family that has opposed, that we did not proceed through. And that's really, that patient didn't have the best organs potential for transplant to begin with. There was a lot of questions with that. Okay. And so we've not had to go against the family's wishes. Every one of those said yes and agreed with the fact that their loved one wanted to be an organ donor. So it's a different world we're in now. It was very different when I was, approaching families and supporting families 15 years ago or so. But we do as delicately as we can, honestly, because we talked about the cultural piece, and for us, we try to be a student of the person, of that family member in that moment, because we, as a culture, you can think of, in general, people may grieve certain ways, but still each culture has subcultures within it, right? And so we have to be students of that person in that moment. And then I think the other piece is recognizing and respecting the way this family is grieving. Ingrid mentioned, 50 people and sometimes, the hospital staff may get frustrated because they've been working with this family for some time. And we are the ones that try to be, I guess, in a way, the source of calm and understanding, and again, respecting that this family's, it's not right or wrong. There's no right or wrong grief. It's just different. And the more that we, establish that with the family, you establish a trust. And everything that especially Nyla and Ingrid spoke about as far as supporting, as long as you're making sure that all of those pieces are taken care of, then you generally don't have to go through with any legal barriers or any other means, honestly.
Mm-hmm. Okay. Dr. Callender, on the multicultural question, is it still true that I know it was when I first met you in the 90s, that African-American families were not in large numbers signing up to be donors? Is that still true? Is that better?
It's much better, but there's still a percentage of our people who still believe that they need their organs when they go to heaven, forgetting that it is in giving that you receive, it's in parting that you're pardoned, it's in dying that you're born to eternal life, and that there's a new earth, a new heaven, and another body, a spiritual body, so that education plays a major role in helping some of those people to understand that the most Christian thing you can do is to donate. And that's exactly what God wants you to do. And so,
not the most human thing to do, the most compassionate, no matter what your religion would be?
Yes, I think you said it well.
Yeah.
You said it well. And most of the Muslims and other groups that are religious will say to you that saving a human life is one of the greatest things you can do. Mm-hmm. And therefore, the compassion and the caring thing to do is to help somebody who would otherwise not have a second chance of life.
Right. Ingrid, I'm going to come back to you. In the African-American community, there is, as Dr. Callender articulated, religious issues around being a donor. In the Latino community, but also in the, let me add this, but also in the African-American community, there is a fear that you will be left to die because your organs are needed. You could keep 5 people alive, and that the emergency room or the doctors will not do the best for you because they want your organs. That's wholeheartedly not true. And in a year of working with all the donor organizations and doctors we've had on, that's wholeheartedly not true. Does this fear exist in the Latino community?
I think that fear exists through all the cultures that I have ever talked to. I think, right, that's like the biggest misconception, the biggest myth in any color of families that you will talk to. Immediately, if we talk to the family at the hospital or we're doing community education, that's the first one that it comes. No, I will not never register because you guys, if something happened to me, they will take my organs and they won't save my life. And so that is something that I think all of us have heard or hear almost every day and try to like educate when we have the time, like right now we're doing. And thank you for asking, because that is like a major misconception. I'm talking on how that is not true. That's a myth. That's a misconception. That if something will happen to you, we talk about, and the doctors in the emergency room, first of all, I'll say they're not transplant surgeons. They're not even equipped to go and take your organs. Mm-hmm. Second, your organs might not even be suitable for donation. Something will happen to you. You don't even, there is like 165 million people registered in this country. What is the percentage, Dr. Kandar? Like less than 4%, like 3% can really become organ donors or die in circumstances that could make them eligible to donate their organs. And so thinking that just because you're registered, you become a donor, I see it as a privilege to be an organ donor. I see it like if I'm able to be an organ, that will be a privilege. So first of all, that, you don't know that it takes so many hours, sometimes even days, to do all the exams and tests and examinations to really know if you are or you have organs that can be transplanted, and also to see if there is people that are compatible with your organs. So that takes a whole process. So killing you or not giving you the medical attention that you need in order to transplant your organs, it really doesn't. You also have to be, like I say, in circumstances so your organs are suitable. And also, as Dr. Kandar could speak on this much more than me, doctors take an oath to save lives regardless. So they're not why your life will be less important than somebody else's. So when we have these conversations and when we have time across different cultures to talk about this, and people are like, oh, that's true. Oh, wow, I didn't know. People think that just because, you have the heart in your license, so you have registered as an organ donor, then you're automatically suitable. And that is not. We will never recover organs that are not going to save lives or going to be, for other purposes of like research, if that's something that's.
I think you've made such a good point,
Yes.
Ingrid, such a good point, because I think most of the people who don't want to be an organ donor think that the doctor in the hospital
Will be the one that
can just scan his or her hands over you and know that your kidney, your heart, your whatever is good. And that doctor has not a clue. And these are specialists who have to go in and recover the organs. That doctor who sees you in the hospital, or your primary care doctor, or your spouse who finds you dead, cannot know anything about this. And so that's a really good point. Do you find that this, and then I want to come back to Nyla. I have a question for Nyla. Joey, do you find that it's true that people actually across the board don't want to be donors because of a political fear of?
Yes. So all of these things. So of course, again, being in the previous roles, I was able to go out and into the community like Ingrid and Cheryl and meet many others. And we have podcasts now. Nyla and I are part of one that we get to talk to so many different groups and so many different from all cultures, all ethnicities, and it doesn't matter. It's the same concerns that we're talking about with the Hispanic community is the same as the Asian community, is the same as the African American community, is the same with the Caucasian community. They're all the same, especially the one that you mentioned with, they're just going to leave me to die just to save someone else's life. My family has actually told me the same thing, and I worked in the emergency rooms before, and I can tell you with certainty, two things. One, we did everything to save that person's life. We didn't think about donation or transplant. That was for a transplant center, and there are very few of those in comparison to the donor to the hospitals. And number two, they have to do everything in their power to save that person's life in order for them to die in a way, with specifically brain death, that they would become organ donors. So they're actually trying to save their life. And then unfortunately, some people's lives can't be saved. And then in that capacity, in that way, they would become organ donors. So if they just let them go, then as Ingrid pointed out, they wouldn't become organ donors anyway. But that is across the board.
Okay. So Nyla, I wanted to know from you, when you come across this, a family is in such grief, and or their family member is about to die, or the family member for you, the family member has died, and the family member has not indicated that they want to be a donor, but there's a good chance that this person should do it, but the family's going, no, they're gonna, they just let him die so that they could get these organs. So when you walk up into that sort of a situation, what do you say? What is the service you give there?
Gosh, I tell you, it's been a while since I've been on the front end of donation because I'm more on the back end.
Okay.
But walking in and still hearing my colleagues and I used to do, whether they're registered or not registered, it's the beauty of bringing that individual's voice back into the room. So once you can have a family focus and start really trying to think about, we've got to make decisions here, and moving forward with those decisions is just trying to bring that person back into the room with us to see what they would have wanted. If you don't know if they wanted to donate or not donate, what kind of person were they in this world? Did they give? Were they shy? Were they outgoing? What kind of life did they live? Because we want to know that person. I think it was Joey that said we become a student of that moment, of that environment, of that always learning, of the culture of the family. We become a student of the family because it's important to know who that person is, and and do they want to continue that legacy of that person? I loved what Ingrid said when she said about how it is an honor. I think it's like less than 3% of people can even be an organ donor. Yeah. And it's incredible.
Yeah, it is an honor. It is an honor. It's an honor also to do these programs with you guys.
And and I'm just going to kind of piggyback on what the conversation that y'all were having, but even families that are scared, it's interesting because on the back end, even after the donation occurs, they hear the beautiful gifts that their loved one was able to give others. Sometimes we still have families months later saying, I was still scared. And I think it's that continual support that they're almost surprised when they get a call back from us. So to gain trust doesn't just start before donation, it continues after donation. And when we talk about mental health in our community, with our families, with the people around us, and the staff at the hospitals, it is constant education, passion, and communication, and bringing families back to the hospital to talk to the staff, to show them that, this was this helped heal possibly, that the family appreciated the support that they were given. And there's so many, I know that Cheryl's story continues with donation, and a part that, our hospital staff doesn't always see are the tissue side, the tissue recipients. They're not there face to face when we're making those phone calls with the families and supporting them when they're alone or at home or in a car driving, pulling over to talk to us. And, Cheryl, what's so beautiful about her story is that it's just got every piece of donation in it. And she's out in the community fighting for that, for all areas.
Well, we have just a few minutes left, and Cheryl, I'm going to let you have the final word.
It's supposed to be a vacation week, but as I hear everyone talk about organ donation, I realize it's 24/7 sometimes. This past 2 weeks has been exciting, and yet grief came on me again. I had one of my sister, number 6, call, and she said, "Oh, you got Essence Fest this week coming up." I said, "Yeah." She said, "Aren't you tired of talking about Tavia and Sheila and Roderick?" She said, "Want you to? It's time for you to let it go. Aren't you tired?" She said, "Sometimes I just get tired of hearing it, Cheryl." And I spoke to my sister Donna and my other brother, and I realized her grief is still there. It's still there, and she want me to stop talking about it. That's what I heard from her. And I told her the job has been such a blessing helping others, because that's how I got through that first year with LOPA. I found so many people like me, and we can cry together. And one employee is out in Lafayette, Joey, our girl, Libby. I met Libby 20 years ago, and she lost her son. I lost my brother. And of course, at that time, when I started, I lost Roderick, and he was a tissue donor. Of course, by that time, I knew about corneas and transplantation. But I tell you, grief, it doesn't end. My son, I feel sometimes, he continues to talk, he misses his dad to this day. So grief is ongoing, whether we talk about it, and someone like me who held it in for quite some time because I didn't know who to say it to. I didn't know if anybody would understand what I was going through. But when I got to LOPA, and I tell everyone, my healing began when I began to share my story, began to listen to others and how we can help each other through what we were going through. Yeah. And on another note, I wanted to share Essence Fest. This is our, excluding the pandemic, but this will be our 21st year as a participant in the wellness, community outreach and wellness part of the festival. We're in the convention center. And this year we found that more people signed up to be organ donors, sharing their, they was proud to show us their driver's license. We normally have anywhere from 300 to 400 people sign up. This year we got just a little over 200, but the excitement was people pull out their wallet and showed us their driver's license. Amazing.
That's great. And I want to tell to the audience, for those people who don't know what Essence Fest is.
Oh my God.
Essence Fest, Essence Magazine, which is probably 40 years old now, has a jazz festival in New Orleans every year since they started. And thousands of people go to New Orleans to hear great music, to buy great jewelry, to hear great speakers. And so Essence Magazine focuses on Black women, but everybody goes to Essence Fest. And there are vendor opportunities that Cheryl is talking about. So I just want to tell the audience who didn't know.
Thank you for explaining that. And it was a great year. We didn't expect a lot of people because, of the pandemic, but the city was crowded. Crowded. And the focus this year, we were celebrating the 20th year with Essence. And also we wanted to Second Line for Life. So we had a gentleman, he works for LOPA as well as, is he a transplant coordinator, Joey? I think Terrence, a transplant coordinator.
Yeah.
He was a Zulu tramp, and he was our Tramp for Life. Mm-hmm. And that brought a lot of people to our booth. And of course, we did have folks every day throughout the day saying they would not want to be an organ donor. They want to take it to heaven with them. I had a gentleman tell me a couple of years ago, you know what, I want to be an organ donor, but not my eyes. Because when I get to heaven, I want to see Jesus. I will never forget what he said to me because he meant it. And I thought, I'm not mad with you because when I was first asked to become, donate my brother's corneas, well, I say his eyeballs, I said no. But yet when Roger passed away, that was the only thing that we could donate was his corneas. So education is so important. Community education.
Yes.
So important because I look at myself and how I felt.
Yeah.
Oh, no.
We're running out of time. I'm so sorry to interrupt you. We are.
I'm a talker.
Yes. You've had such wonderful things to contribute. And I'm sure that the producers of this show will one day, soon maybe, do a show where we can get religious leaders to come. And I hope many of you who are on this panel right now will join that conversation. We can have a full-on conversation and ask everybody to pull out their holy books and say where this comes from so that we all can have a better understanding of the resistance. Once again, I want to thank all of you for being here and giving your time, your efforts to not just this program, but to this worthy cause. You are soldiers in a very, very mighty and important war. So thank you. I'm Joya Jefferson Nuri. I was your conductor for this show, this profound conversation. We'll see you next time.